morning, everybody, and welcome back to the Prestige webinar series. My name is Melissa Analfo, and I am the Client Success Specialist here at PrestigePEO, and I am your host this morning as we bring you the latest installment of our webinar series. This morning, I am joined yet again by Kathleen Sullivan, PrestigePEO's Associate Director of Benefits, and today we have a pretty intense agenda for you. So we're going to open up with some compliance updates regarding the New York HEROES Act and then the nationwide path out of the pandemic plan. And then we're going to call up Kathleen, who's going to take us through some information that's really important as we dive into open enrollment and just good to know info about terms, terminology, info on the plans, anything that's new and changing as we are kind of well on our way into the renewal. As always, all participants are muted. We do encourage you to use the Q&A features of the chat so that we can address any questions. If we cannot get to them today, we will get to them after the fact, so please don't let that discourage you from reaching out to us. If you need this information after today, this webinar is being recorded, and the accompanying slides are going to be posted on our blog, The Prestige Perspective, at www.prestigepeo.com/blog. It might be up later today or tomorrow. Keep an eye out, or you can reach out to your service team and we'll let you know when it's good to go. All right, so the HERO Act. The New York State Health and Essential Rights Act, also known as the HERO Act, is an airborne infection disease exposure prevention plan. All right, so all New York employers were to create this plan using the state's guidance. If you had taken a look at it, it was like a 6-page document outlining essentially all the protocols taken in place should the business need to now move forward with that, right? So we're talking social distancing, administrative controls, building controls, HVAC, things of that nature. So this plan was to be created and then communicated to all employees, posted for all employees to access by September 4th. This plan was intended to be forward-thinking, having something in place for that if and when scenario, until September 6th, when Governor Kathy Hochul announced that COVID-19 is designated as a highly contagious infectious disease by the health commissioner. This now means that as of September 6th, all plans need to be implemented, and companies now must adhere to those safety measures outlined in those plans. Now, it's also important to note that there are anti-retaliation measures in place for employees of companies who do not comply. So if you have that, take out that plan, take a look at all of those items that you've already addressed. More often than not, organizations were using what was put in place last year with all of those requirements. Now those should be back in effect as of September 6th. So that should be an immediate implementation of these items. Next, we're going to take a look at the path out of the pandemic. So the path out of the pandemic plan is a series of expectations on businesses to navigate the reopening of the day-to-day businesses safely. President Biden has called on the Department of Labor's Occupational Safety and Health Administration, also known as OSHA, to develop these standards. So at this time, there are a number of things that we can begin to expect from this plan. So large employers can expect some level of vaccination or testing requirements. So if you're over 100 employees, think vaccination requirements or proof of vaccination requirements, I'll say, or weekly testing to prove a negative test should you not be vaccinated. Federal workers and contractors who do business with the federal government must be fully vaccinated is another expectation, as well as healthcare workers at Medicare or Medicaid participating facilities also must be fully vaccinated. One other item is that time off benefits are expected to be provided to employees who need to fulfill the above standards. That's something to keep in mind and to look out for as things kind of move forward. So these emergency temporary standards, the ETS, are expected to be delivered in the next 3 to 4 weeks. So keep in mind, again, this is not a plan that you are developing on your own for your organization. This is something that's going to be put in place by the government that companies will now need to adhere to. So we don't have any guidance yet. We don't have anything in writing. Like I said, about 3 to 4 weeks, we do expect something to come down the pike. So as per usual, Prestige is going to be monitoring these items, keeping an eye out for what needs to be implemented and when. So rest assured that we will be advising of this information. So take a look out for the insights communication, future webinars, or just communications from your service team. If you have any questions as we move forward, please reach out to us. We will do all we can just to kind of keep any fears at bay, and, we'll help you navigate the next steps, with any changes that are put in place. All right. So now I'm going to call up Kathleen. Kathleen's going to start taking us through some benefits information and open enrollment-centric stuff. So with that, hello, Kathleen.
Hi, Melissa. Thank you so much. You hear me okay, right?
Yes, you're good to go.
Okay, good. All right, thank you for the introduction. I am Kathleen Sullivan. I'm the Associate Director of the Benefits Department here at Prestige. Today, I'm going to go over some insurance terminology, some insurance plan types, and then finally, I'm going to get into the changes to the plans this year for open enrollment. The aim of this webinar is to give you basic information and then a little more than that, so you can feel knowledgeable and informed as you decide on the plans to offer to the employees of your group. It's going to start out a little elementary, but stay with me. I'm just laying a foundation to go into more complicated information later in the webinar. So next slide, Melissa. Okay, so let's start out with the very basics. These are a couple of insurance terms that I want to make sure everybody understands, and that way I can describe the plans in a little more detail later. Copay, that is the easiest definition. Everybody is used to the copay. You go to the doctor, you hand them your card, it says you have a $25 copay. That's what you pay the doctor, you leave, and you're done. So that's the simplest of the explanations. Deductible. A lot of plans have deductibles. They have them out of network, they have them in network. Sometimes they apply to everything, sometimes they don't. So you have to look at the plans and consider where the deductible applies. But a deductible in a health insurance plan is the same as a deductible in a car insurance plan. If you have a $500 deductible on your car insurance plan, you get into an accident, the first $500 of that repairs is on you. Works the same in the medical field. So if you have a deductible, generally it comes first. Coinsurance. A little more complicated, but that's the period of time in a plan where the carrier pays a percentage and the employee pays a percentage. So some of the plans, that split will be 80-20. Oxford will pay 80%. The employee or the insured will be responsible for 20%. Generally, the coinsurance comes after a deductible, and it always has an end date, and that's what I'm going to move into next. Maximum out-of-pocket. In my opinion, this is the most important definition and one of the most important things to look at when you're looking at a plan. So maximum out-of-pocket is a little more complicated, but basically the simple explanation is when you're on an insurance plan, every time the employee pays a portion of the cost of services, so maybe they have a copay at the doctor of $25 or a copay for a prescription of $50, or maybe the plan has a deductible of $1,000. And every time the employee pays money out of their pocket, they're adding that up, Oxford or Emblem or United Healthcare, whichever your carrier is. And when the employee reaches a certain level, out-of-pocket max could be $2,500, could be $6,500. When the employee reaches that out-of-pocket maximum, then the carrier kicks in at 100%, and the employee is done. So that's a very important number, and we'll look at it in terms of actual plans so you can see it and hopefully understand it a little better. But it basically represents the insured's total risk for the year. They shouldn't come out of pocket for more than that if they're in the network and for covered services. Okay, next. Okay, the next thing we're going to talk about is type of plans with relation to network access. So you can keep going. All right, so we have a couple of different insurance type plans. We have EPOs and HMOs, and in general, those are plans where you're only covered inside the network. The EPO is a little more liberal in that you're covered in the network, but you never have to choose a primary care physician and you don't have to get referrals. The HMO is a little more restrictive. Often you do have to choose a primary care physician and get referrals, but sometimes HMOs are also set up where they're non-gated. So that's not a hard and fast rule. But in general, EPO, HMO plans where you're only covered in the network. Point of service and PPO are a little more liberal. Those are the plans where you're covered both in and out of network. The point of service is usually based off of an HMO plan, so often there are primary care physicians and you need referrals, but not always. Sometimes they're non-gated, and PPOs are never gated. So those are coverage in and out of the network. Out of the network, plans usually have deductible and then co-insurance levels after. Okay, next slide. So to try to talk about these plans, you can go to the next one. Thanks, Melissa. I'm going to compare our plans, Prestige, Plan 3, Plan 4, and Plan 8, because these plans kind of hit on all the different types of plans. And I want to talk about traditional plans, cost-sharing plans, and high-deductible plans. So you may want to incorporate all these type of plans into your offering to what you give the employees to choose from for this open enrollment. All right, next slide, we'll start with Plan 3. Okay, so describe Plan 3. Plan 3 I usually talk about as a truly traditional plan. This is kind of almost an old-fashioned plan where everything on the plan is a copay. So you'll see at the top, there's no deductible. This is an EPO plan, so the out-of-network column is not applicable. So this is an in-network only plan. This happens to be our best in-network only plan that we offer at Prestige. So it's a very good, rich benefit plan. So you see no deductible, you see no deductible, but you do see the out-of-pocket maximum there, $2,500 and $5,000. $2,500 for the individual, family is $5,000. The way to reach that out-of-pocket max is through copayments. So we'll look down the line, you see preventive care covered at 100%, it always is. Outpatient care, office visits, your regular doctor is going to be a $30 copay, specialist is a $50 copay. Urgent care falls under that specialist copay of $50. Surgery, so your same-day surgery, outpatient surgery, where you go home the same day, $250 copay. And now lab services diagnostics. So these look a little different than you're used to because there is a slight change in this plan, and I'm going to go over the plans, the changes from Oxford for our plans. But you'll see lab services done at a freestanding facility, they're covered in full. They always were on Plan 3, they remain that way. But lab services done in a hospital setting would now, for the first time, have a 20% coinsurance. Diagnostic services or x-rays, same thing. Done at a freestanding facility, covered in full, the way they always were. And that also includes the major diagnostic services like MRIs and PET scans. Those are also still covered in full as long as they're done at freestanding facilities. But if they're done at the hospital, they would now have a 20% coinsurance level. So that's one of the changes this year that I'll go into a little more detail in which plans it applies to later on in the presentation. Okay, let's move down to the hospital services area. $500 copay, that's per admission. So if you spent 2 weeks in the hospital, it would cost you $500 on Plan 3. Emergency room is a $300 copay, and then the RX coverage is three-tiered with a $100 deductible. That's annual, resets in January, only applies to tiers 2 and 3 drugs. And that's how that coverage works. So as we go down a little bit, there's one more change. Under substance abuse, you see outpatient. That used to be covered according to the specialist copay. It's now covered according to the primary care copay, the $30 copay. So that's a nice positive change for Oxford. And something that's not on this menu, but is another change for Oxford, is that virtual visits are now going to be covered at no copay for all of their plans. So that's a really nice benefit. It does apply on high deductible plans after the deductible is met. That's when they'd be covered in full, but on the other plans, they're covered in full right away. Okay, next plan. Plan 4. So this is a really good example of both a cost-sharing plan and a PPO. So you can see that both columns, in and out of network, are populated, because this is a PPO plan, so you can go in and out of network. You also see that there's a deductible, $500 and $1,000 at the top, which means this plan is a cost-sharing plan. It has a deductible in the network, but not everything is subject to that deductible. It also has coinsurance, 10%. So that means for things that are subject to deductible and coinsurance on this plan, you're going to pay the first $500, then Oxford's going to pay 90%, and you're going to be responsible for 10%. That's the coinsurance phase of the plan. Okay. The next thing we see is the out-of-pocket max. Now this one's even lower. $2,500 is what we saw on Plan 3. It's only $2,000 on Plan 4 and $4,000 for the family. So that's a very low risk for the year for an employee for their coverage, $2,000 if the worst of the worst comes and you're in the hospital for weeks and you have a really bad year. For in-network services, the most you should come out of your pocket is $2,000 before Oxford kicks in and pays 100%. All right, let's look down a little bit more. We know preventive care is always covered in full. Office visit copays on this plan are a little lower, $25 and $40. Urgent care, again, goes by the specialist copay. Okay, and now we see the lab services and the diagnostic changed a little bit on this plan too. So lab services done at a freestanding facility, still covered in full the way they always were. But if they're done in a hospital setting, they would have 20% coinsurance. Diagnostic services, that's x-rays. Freestanding facility, they'll be covered in full, but in a hospital setting, 20% coinsurance. And then MRIs or major diagnostic services, that's going to be deductible and 10% coinsurance at a freestanding facility, and then deductible and 30% coinsurance if they're done in a hospital setting. Okay, the rest of the plan stays virtually the same. Let's move on to the next plan. Okay, so this is Plan 8, and I wanted to bring this plan because this is a very popular plan for Prestige, but it is a high deductible plan. So it's a little different than anything we talked about before. High deductible plans, generally everything is subject to the deductible first, and then the carrier comes into play. The only exception to that is preventive care. This plan has $2,850 deductible for the individual, $5,700 deductible for the family. Now, high deductible plans are a little different in that when you're a family, when you're enrolled, either as an employee and spouse, employee and children, or full family, that $5,700 deductible is the only deductible that applies to you. So even one member of the family can go all the way up to that family deductible. So it's important to know that when you're looking at a plan like this. The only time the $2,850 applies is if you're actually enrolled as an individual. Okay, now the reason I like this plan is because it's unique. Even for high deductible plans, this one's unique because after that deductible is met, it acts like a traditional plan. It defaults then to copayments for doctor visits and for urgent care and for prescriptions. So it's not a straight percentage where you could come out of your pocket for a lot. After that deductible, this plan looks like a regular traditional plan. So we'll see the differences. The lab services and diagnostic did change on this. Freestanding facilities, after the deductible is met, they would still all be covered in full. But if they're done in a hospital setting, all three, then they would have 20% coinsurance. That's new. Everything else on this plan is subject to just copayments after the deductible. So high deductible plans are different, and employers can do a lot with plans like this. you see that there's more risk, right, for the employee. They have more expenses to pay because they're going to pay for everything up front. But an employer can mitigate that, and because the employee has more risk in the beginning, the premiums for plans like this are lower. So a couple of things, a couple of ideas you can do are you can set up health savings account plans, which are really very beneficial to the employees and very attractive. So if you as an employer want to save some money on premium, maybe you want to give the employee some money towards a health savings account, or just offer a plan like this and it's less expensive for the employee. They can put money into a health savings account. Health savings accounts are great options, very attractive to the employee. Money goes in pre-taxed, grows in interest, no tax, and can be used for qualified medical expenses at any time, no tax. Those plans roll from year to year, and when you're 65, they function like retirement accounts. So an employee, especially young and healthy, doesn't have a lot of medical expenses. This is a great opportunity for them to tuck some money aside into a health savings account, build up that account, and then they don't have to worry about what medical plan they have in the future from any employer, because they have their own little safety net and nest in that health savings account. And it's a really great option. Another option with a high deductible plan is a health reimbursement arrangement. So that looks a little more attractive to an employer, and these are just strategies to think about that you can talk to your broker about and you can talk to your benefit specialist about if you want to include a strategy like this to save money. But a health reimbursement arrangement, or an HRA, is a plan where the employer promises to pay a certain amount of the deductible, so they're protecting the employee from having to take on that big deductible themselves, but they only pay out when claims are incurred. So maybe an employer would take a plan like this and promise to pay the first $2,000. Now, if you have a lot of employees, not a lot of those employees are going to hit that $2,000. They're not going to use all that money, so you're going to save in that money that you promised to pay. You're also going to save in the premium. So you promise to pay it, but only if claims are incurred. And in general, employers usually win on a situation like that by getting to pay those lower premiums, still supporting the employee. It's a good option, definitely something to talk about to your employees. Okay, let's get into the changes for this year. Next slide. Okay, so some of the simple changes. Oxford plans, they changed the termination rules for dependent kids. So I just want to make sure that all the employers out there know that, and the employees. They are now going to cover dependents until the end of the month in which they turn 30, and that's for Oxford, New York. It's a little different for New Jersey and Connecticut. Those plans run on the 26 years for dependents, but Oxford, New York, we have that rider that runs until 30. So dependents used to be covered until the end of the year in which they turned 30. Now it's just the end of the month. So I want to make sure everybody knows that. Second thing is new cards are going out. So I know employees got new cards last year. There was a change in ID numbers. This year, no change in ID numbers, just a change in the cards. There was a state law that changed, and they want specific information on the cards, so everybody's going to get new cards from their carriers. But the ID numbers didn't change, so if you kept using your old card until you get the new one, you should be fine. Doctors should still be able to find you. So not as big a disruption, just information. Want the employees to know they're getting new cards. They should throw the old ones out and start using the new ones when they get them. Okay, Peloton. Now, this is not specifically an open enrollment change, but it is something I wanted to mention because not everybody knows about it, and it is a great benefit that Oxford started offering in September. So they are covering the cost of Peloton membership. So they're not going to pay for the bike or the equipment because that's very expensive, but they are going to cover the cost of membership, and that's part of their wellness program. So, and that's separate from the gym reimbursement that Oxford calls sweat equity. So that's a separate benefit. It's in addition to. So if you have that sweat equity program, that's where Oxford reimburses up to $200 every 6 months. If you go to the gym 50 times, Peloton is a separate and great benefit that I wanted everybody to know about. Okay, next slide. Right, here we get into the slightly more complicated plan changes and the reason I wanted everybody to have a foundation. So first, substance use disorder services, outpatient care, that's going to be covered at the lower primary care physician level copay now going forward. So that's not going to be, used to be covered according to the specialist, but now it's going to be the lower copay. So if it's 30 and 50 are the copays in the plan, it'll be covered at $30 copay going forward. That's a positive. All right, here's the more complicated. Oxford's implemented place of service tiering on lab services on minor and major diagnostic services. So we talked about it a little bit when we looked at plans 3, 4, and 8, but basically it applies to, on the main Oxford plans for New York, plans 1 through 9 and 15 through 18. So the cost of lab services will continue to be no copay at freestanding facilities, but will change to 20% coinsurance for lab services when they're done in the hospital setting. So I just want employees to know that. Basically, the theme here in these changes is for employees not to go to the hospital for things or not to have things sent to the hospital. Most of the time now, doctors are going to send lab work out to Quest, the LabCorp. They're using freestanding facilities. I don't think that we're going to see much of a disruption with this change, but I want to make sure everybody's aware. For diagnostic services, there will be 20% coinsurance on plans that had none before, or 20% coinsurance increase for the plans that did have them. Again, this is only in the hospital setting. So no changes. So if there was no coinsurance for diagnostic services before, that's going to remain for freestanding facilities, but it is going to increase for hospital settings. And this will apply on the high deductible plans 7, 8, and 17 after deductibles are met, because those are our high deductible plans. Okay, next change, very positive, a really nice benefit, I think. All Oxford, New York plans will have virtual visits, virtual visits will be covered at a zero copay. Now, for high deductible plans, and in this case, it's 7, 8, 11, 14, and 17, because those are all of the Oxford plans that are high deductible, it'll apply after that deductible is met. But on the rest of the plans, it's right away. So if you're using virtual visits and you're checking in with the doctor that way, there'll be no copay for that. Next slide. UHC national plans. So the changes are very similar on the UHC national plans to the Oxford plans, where they are recognizing the place of service tiering for lab work and for diagnostics. So, and then applying coinsurance there. But the first change on the UHC national plans is that out-of-network providers will be determined based on 100% of Medicare. So that wasn't the case before, and I want to make sure that everybody knows that. Okay. Now, the UHC plan, implementation plan, place of service tiering, it changes on all the plans, but specifically I want to note plans 8 and 9, major diagnostic services will have a $400 copay at freestanding facilities and hospital settings. That's one of the changes for the UHC plans. Next slide. Emblem. So Emblem doesn't have any changes to their plans, but they do have a very positive change to their network this year. So we wanted to talk about that because it's great. So we currently offer 5 Emblem plans, but plans 1 through 4 were HIP Prime plans. So they use the HIP Prime network. This year, they've changed that, and plans 1 through 4 will be part of what Emblem is calling the Bridge program. So the Bridge program makes up 5 Emblem networks rolled up into one that employees will now have access to. So last year we had some changes to Emblem where we had some plans that used the GHI network and some plans that used the HIP Prime. And people liked that GHI network, so it was a loss when we lost that. But that's back now, and it's back on all plans. So you can see the 5 networks that are now part of this bridge program are the HIP Prime, GHI National, QualCare New Jersey, Connecticut, and First Health. First Health is the national network that they lease. So all the members on plans 1 through 4 are going to get new ID cards, and they're going to see next to the network bridge. Now, I want to mention, because we've already had a little experience with this, the doctors may not all know about this bridge program. Emblem's communication out to the doctors is sometimes not stellar. So I'm being very open on this. I want to make sure you guys know. You definitely do have access to HIP Prime and GHI National doctors. So if there's any issues with that, if the doctor doesn't know what the bridge program is or doesn't know that they are part of the network, reach out to your benefits specialist and we will intervene and we will solve that for you. So, and that communication will keep growing, but it is fairly new for Emblem, this bridge program. So I would expect there to be a little bit of interruption there for doctors' offices and staff to not know exactly what the bridge program is. Okay, next slide. Okay, dental plans. So this is the next thing. So as an employer, you're deciding on what medical plans you want to offer to the employees, which dental plans you want to offer, vision, and then if you want to add anything in the way of LTD or STD or life insurance. So I wanted to go over the things that you're making choices on. I'm going to go over the dental pretty briefly just so you understand the 4 MetLife plans, and then we'll move on. Okay. So the best dental plan we offer is MetLife Dental Enhanced, and that's that first column. And this is an excellent plan. Premium right next to it is almost identical. So it's easier for me to just describe the differences than to go over each plan one by one. The enhanced plan has a $5,000 annual maximum benefit per member. That's what makes this plan very special. The other thing is you see in and out of network coverage. Now on the enhanced plan and the premium plan, when an employee sees a dentist who's not part of the MetLife network, they're covered according to what's usual and customary. So you see UCR up there. And that's very good in the dental world. So on these 2 plans, you're covered very well in and out of the network. The other difference between the dental enhanced and the premium plan, one, the enhanced has the $5,000 per member maximum benefit. Premium has $2,000 per member. Still very good, but not quite as high as $5,000. And then the other difference is the periodontics and endodontics on the enhanced plan, they're covered at 80%. They are generally major services, and major services are covered at 50%, but those particular services, we did move into the basic services range, which is that 80% covered. So that's a nice benefit. Otherwise, those 2 plans are the same. The plan next to it, the standard. So standard is still a good plan, uses a good MetLife network for dentists, the same as premium and enhanced. It's called PBP Plus. But the big difference for the standard plan is that MAC. So instead of UCR at the top, you see MAC, which stands for Maximum Allowable Charge. So on the standard plan, when you go out of network, they're going to pay an out-of-network dentist according to what they call a maximum allowable charge schedule. And that is not as good as reasonable and customary or usual and customary like the other plans. So it's still a good plan, but I would suggest for employees, if they're taking this plan, to try to stay in the network. You also see that the coinsurance levels change a little bit. So preventive is still covered at 100%, but basic services drops to 60% and major services drops to 40%. Also, the annual maximum benefit is $1,000 per member per year. The last plan, the furthest column, that's the DHMO plan. That's still a good dental plan, but it is more restrictive. The DHMO, you have to choose a dentist that's in the network. You have to see that dentist that is designated for the employee, and then everything is paid according to a schedule on that plan. So a cleaning would be $5. A filling, the schedule might require the employee to pay $15, but everything goes according to a schedule, and obviously the more expensive things, the more the employee is going to pay for them. Okay, next slide. No changes on the vision this year. So we use UHC vision, and with that UHC vision, you get access to the Spectera network and also Warby Parker. So this is a standard plan. Most of our employers offer this. They sometimes offer it as voluntary for the employees to pay for themselves. Some employers pay for it. It's up to you how you want to handle that. But no changes to the vision, still good coverage. Okay, next. Okay, so not all of our employers offer short-term disability and long-term disability as far as plans with a higher benefit. All of our New York employers always have the statutory disability, which is standard and has to be, but this short-term disability would be on top of that. And we do offer 4 good plans. The language here is pretty obvious, but I just wanted to make sure that everybody knows that we offer these plans. You can see the weekly benefit, 50% of the employee's pre-disability earnings, up to the maximum on Plan 1 of $1,000, Plan 2, $1,500, Plan 3, $2,000, and Plan 4, $2,500. So that's our range for short-term disability. Elimination duration. So 7/7/26 might look cryptic to you if you're not an insurance person, but basically that first 7 stands for days of injury. The second 7 is talking about days for sickness, which also includes pregnancy. And then the 26 is the benefit duration, so the amount of time that they're going to pay out the benefit on a short-term disability plan. Okay. That's maximum benefit duration, 26, short-term disability. If you wanted to add a plan like this, you're going to reach out to your benefit specialist and let them know, and then they can give you some pricing for this. Next slide. Okay, long-term disability. So this is a little more complicated, and we have a few more plans offered, but also a fantastic benefit for an employer to offer to their employees. You're really giving them excellent protection, and I know a lot of our employers are looking for ways to add to their employee retention. So plans like this, adding plans like this, bring a big benefit to employees. So across the way, I just want to go over some of the terminology so employers know what they're looking at. Benefit percentage, that's 60% of salary on most of these plans, except for 5 and 6 where it's 50%, but that's basic. You can see the maximum monthly benefit for LTD. So we were talking about weekly before, but now we're talking about monthly for LTD. The elimination period, that's pretty standard. It's either 90 days or 180 days, so the employee has to be disabled for that amount of time before the benefit kicks in. And now we reach the first definition that I want to kind of go into, which is own occupation. So most of our plans cover the employee if they're disabled and they can't do their own occupation, which means they're unable to earn more than 80% of their pre-disability earnings at their own occupation, right? And that's a big deal, and that's the best kind of LTD plan you can have. If we look at plans 5 and 6, you'll see that you're covered for your own occupation for 2 years. After that, on plans 5 and 6, which are a little bit lower plans with a $2,000 monthly benefit, but they're also less expensive plans. Those are going to cover you for 2 years at the own occupation, and then after that, they would have to be disabled and unable to earn 80% of their pre-disability earnings at any gainful occupation. And that's anything that they're reasonably qualified for, taking into account training, education, and experience. So a little different. After 2 years, they could still remain on benefit, but it would be only if they couldn't do any gainful occupation. All right, just below that, benefit duration. Now we have some letters that may not look obvious to people. RBD, which is defined just below as reducing benefit duration. And what that means is when an employee gets disabled, it depends on their age, right? So for how long they're going to be covered. So if you're disabled and you're 50, you're going to be covered until that SSNRA, which is Social Security normal retirement age. You're going to be covered until you're 65 for your disability. But if you get disabled when you're 65, so you're actively working and you become disabled at 65, the reducing benefit duration means that you're going to be covered for 2 years instead, because now you're older than that Social Security normal retirement age. And then that number shortens as an employee gets older and older. Basically, at 70, you're covered for a year on the LTD, 12 months, okay? So that's what RBD means. And that's what SSNRA stands for, normal Social Security retirement age. So if we're looking across those plans, Plan 1 covers you until normal retirement age. Plan 2 covers you for 5 years. Or it does have that reducing benefit duration. So if you get disabled at 65 years old, it would still only cover you for 2 years. And that's the information on the LTD. Okay, next slide. Okay, so that's it for the presentation today. Hopefully that was informative. Hopefully you guys feel more prepared to make decisions and to look at plans. Definitely reach out to your benefit specialist. We have a couple of ways for employer contacts to reach us and employees. We have our open enrollment website, which is excellent, has a lot of information. You can go there, you can see videos of how to fill out that open enrollment grid that everybody just received or is receiving for their groups. You can reach out to the benefit specialist, either mobile app or email or direct dial, which I recommend for anything more complicated and questions that you have. You can also contact our benefits team at that 833-PEO BEN1. Now that is more meant for employees and specifically for employees who maybe are getting stuck as they're going through the portal to make their elections, which employees haven't started to do yet, but they will around 10/4, October 4th. But if they have stuck and they need a password reset, or they can't get from one page, or they can't submit their changes, that's the number they could call, and somebody will help them and talk them right through that. And then the last is an email address box that you can send questions to that will be rerouted to your benefit specialist or anybody that can answer those questions, and they'll get back to you on that. So next slide. Thank you so much for your time. Thank you for listening to this presentation. I hope everybody got some information, some good information, and feels a little more prepared. The webinars are going to be available, as Melissa said in the beginning of the presentation, on all of our websites here that you see. And I'm going to pass it back to Melissa to just give a closing statement. Thank you.
Kathleen, thank you so much. I have a feeling we're all going to be waiting for this to be posted. There was so much information here that was so necessary. So again, thank you for putting all of this together and for joining us and educating everybody on this information. And thank you to everybody who continues to join us these mornings. You know, with your feedback, we're able to really cater these to your needs. So again, we encourage you to let us know what information you want to see on these webinars. As Kathleen mentioned, this is going to be posted right here on our blog. So you can see prestigepeo.com/webinars. Also, please download our mobile app, check out the podcast, all of that great stuff just for, you know, continuous information and communication from us. Again, thank you, and we will see you at our next webinar. Have a great day.